Hello, my name's Tivey and I'm going to introduce the paper Ossification of the Ungular Cartilages and Other Osseous Abnormalities. The ungular cartilages of the equine foot can be found originating distally to the palmar processes of the distal phalanx and extending proximally in both the dorsal and palmar or plantar directions. These cartilages can become ossified in some horses, with this ossification originating from the base of the cartilages at their attachment to the distal phalanx and progressing proximally. Ossification of the ungular cartilages of the equine foot has been well documented in the literature, and there is growing evidence to suggest that extensively ossified cartilages, so those graded 4 or 5, can be associated with pain and lameness. This could be due to primary injury to the cartilage itself or the associated ligaments. Extensive ossification of the ungular cartilages may be associated with new bone formation on the palmar, medial or lateral aspects of the proximal phalanx, at the sites of attachment of several ligaments, such as the collateral ligaments of the proximal interphalangeal joint, the oblique sesamoidean ligaments, and several others. In addition, the presence of new bone on the mid-dorsal, dorsomedial and dorsolateral aspects of the distal phalanx has been reported, reflecting abnormal stress on the suspensory apparatus of the distal phalanx. This study was undertaken in an attempt to describe the location and extent of new bone on the proximal and distal phalanges, and to determine the frequency of occurrence of this new bone when related to the ossification grade of the ungular cartilages. As previous studies have demonstrated that draft, cob types, large native ponies and heavier breeds were overrepresented in horses with excessive ossification of the ungular cartilages, this study also aimed to look at the effect of breed and age on new bone formation of the proximal and distal phalanges. Our hypothesis was that new bone formation would be seen more commonly in horses with grades 4 or 5 ossification compared to those with ossification grades of 3 or below. Data was collected from 929 sets of images from the individual limbs of 589 horses. We then used logistic regression modelling to indicate which predictor variables were significant. So moving on to the main findings of our study. In accordance with our hypotheses, new bone formation on the proximal and distal phalanges was seen more commonly in horses with grades 4 or 5 ossification of the ungular cartilages compared to those with grade 3 or below. In addition, there was a higher risk of new bone formation associated with the lateral ungular cartilage compared to the medial. Thoroughbred and warm blood breeds had a lower risk of new bone formation on the proximal phalanx compared to other breeds. And similarly, thoroughbreds had a reduced risk of new bone formation on the distal phalanx. Increasing age was a risk factor for new bone formation on the proximal phalanx, but interestingly was associated with a reduced risk of new bone on the distal phalanx. So the implications of our study really are that new bone formation on the proximal and distal phalanges may contribute to pain and lameness in horses with grades 4 or 5 ossification of the ungular cartilages.